Well, for several years now, the Cystic Fibrosis Foundation has been working to find a cure. It is an inherited chronic disease that affects the lungs and digestive system. In the 1950s, few children with it lived to attend elementary school. Today, thanks to advances in research and medical treatments, it has extended the life expectancy, with many people with that disease living to their 30s, 40s, and beyond. Certainly great news. And joining us now to tell us more, we have Tracy Borchek with the Great Strides Walk Cystic Fibrosis Foundation, and we have Joey Benton, who also goes by Peanut. Joey, why do people call you Peanut?
Because when I was in my mom's stomach, my mom and my dad looked at the CAT scans, and it looked like I was about the size of a peanut, and I was kind of shaped like one, so they called me Peanut.
So you are called Peanut, and when you were just 6 weeks old, you were diagnosed with cystic fibrosis. Now, you have to go to the hospital a lot and go check in with the doctors. Tell me how often you have to go see the doctor.
A normal checkup, about maybe once a month. A CF checkup is maybe too normal as a normal checkup.
But sometimes you have to spend like a whole week in the hospital for tests. Now tell me about when you eat. You have to take a whole lot of pills. How many pills do you have to take to help keep you healthy?
2 for just a drink, 1 for just like a small chip or 2, 3 for a snack, and 4 for a meal.
If you're going to have a meal, I know your mom has a whole bunch of all of your pills in your pocket. Tracy, tell me a little bit about how you met Joey and how he is sort of inspiring so many people to come out and join the efforts to help find a cure for cystic fibrosis.
Well, I work for the Cystic Fibrosis Foundation for 3 years, and the Benton family is one of the first families I met at Great Strides, and they have done a fantastic job fundraising locally. They've reached out to their friends, family, coworkers, and everyone loves Joey. And I feel like they've touched a lot of people and gotten a lot of people involved with our foundation, because what we're doing is really important, and I think people really respond very well to Joey. He's fantastic, and it's hard having cystic fibrosis. You just want to do normal things, and you can do normal things, but you have to do treatments and pills, and it's a lot for a little boy.
And what is that like? Because we know it affects the lungs, the digestive system, and is it a lot of mucus or a lot of things that you have to cough up? I know Joey's mom said he does cough a lot.
Yeah. In general, people with cystic fibrosis have a really hard time getting rid of mucus, so it builds in their lungs, and they're more susceptible to bacteria that we normally could just pass through and we wouldn't even notice. But because there's a lot of thick, sticky mucus in the lungs, it sticks there, and it causes infections that puts people in the hospital for months at a time. And same with digestion. This mucus blocks, the proteins and nutrients that most normal people get from food. So they have, 2 different separate issues going on that they need to treat.
Well, we have just a minute left. Joey, tell me, I know you're going to be going to Washington to talk to lawmakers. What are you going to be talking to them about?
Healthcare and insurance.
And what are you going to tell them that they need to do?
We're going to tell them how many kids depend on hospitals around the nation.
To help keep them healthy, like the doctors keep you healthy, right?
Right.
Well,